Hi everybody, Dr. Troy here. I'm at the Maximize Living Conference in the Peabody Hotel, Orlando, Florida, and with me I've got an amazing chiropractor, one of the leaders in Maximize Living, one of our presenters actually this weekend, one of my mentors, and just somebody I looked up to, I spent a lot of time with, spent camps with. So Joelle, I just want to welcome you to today's program, and one of the things that I really want to just find out from you, you're up in Canada, it's a little different healthcare system up there, but you're still seeing the same amount of sick people that we see here in the U.S. But what are some of the conditions that people are just coming in with that you're seeing amazing changes? Maybe people have been to doctor after doctor, they've had multiple drugs, even multiple surgeries, and there are these people that lose hope. What kind of things are you seeing?
Well, first of all, disease process doesn't stay within borders; it crosses borders. So whether you're in Canada, the U.S., or any country in the world, if you're not getting to the cause of sickness and disease, you will never actually see healing happen. And so as we address cause, and we see amazing miracles in things like blood pressure, in diabetes, autism even. Just last week I had a man who I've been working with him for 8 years, very dedicated patient, and he had hearing restored to his right ear. Hadn't heard in his right ear in 15 years.
Amazing.
Yeah, absolutely amazing miracle happened there. But it's not me. That's what people have to understand. Just like in your office, you say it's not you who actually heals the body. It's God who heals the body. And so when you find the cause of the interference in that body's ability to heal, you will see literally every disease known to man heal. And it's exciting to be part of it. It's exciting to be part of Maximize Living. It's exciting to be at the seminar here when you see, 1,000 chiropractors come together and we share our stories and we communicate together and to get the message out to the masses. It's a fun time in chiropractic.
Yeah, and it's amazing. It's booming. And what do you say to somebody? Because I see this a lot. There's people that I just got an email last week from this guy that. He wrote me, it was like a 3-page email. I'm like, I don't even know how much time he spent, but his wife had RA, and he's like, isn't there anybody out there who's been helped by chiropractic with RA? And he said his daughter's under chiropractic care and made amazing changes, but his wife's very skeptical. And so I was like, I just said to him, I said, there's one thing you got to do. You got to get in action. So if there's somebody that is watching this or listening to this that's suffering, that's been praying out to God for answers and help, what would you say to them? What would you say is the key to just making that first step?
Well, I think the mindset of that person, they have to really analyze what they're doing. And so I always ask the question, how is what you're doing working for you?
Yeah. I mean, that's huge.
How is what you're doing working for you? Are the drugs you're taking working? Are the pills you're taking working? Are the injections working? Is the surgery working? And I'll tell you this, the answer is always no. And so are you willing to do something else?
Yeah.
Because we're going to teach you how to allow your body to heal and function. We're going to remove interference to cause. Does that make sense to you?
Yeah.
Of course it does.
Yeah.
Of course it does. That's why it works.
Yeah.
That's why you can't keep people out of your office. You know what I'm saying?
Yeah. I mean, once they understand this principle, they get it, and it's just like a wildfire. And so, I just really appreciate. I know you're one of our presenters. You've been here all weekend. It's always a pleasure to hang out with you, and I'm glad we got to take this time to interview you and be on the video and the radio here. So
right on.
Thanks
a lot, Dr.
Troy. Yeah,
Troy.
appreciate you.
I appreciate
and all
you
your
too.
time.
Right on. Thank you.
Thank you.